Today we're going to talk about data privacy. Privacy is something RareX takes seriously. Managing issues of data privacy and security are a big task. Most rare disease patient organizations don't have the expertise, staff, or financial wherewithal to navigate the complex legal, technical, and policy landscape of privacy. At RareX, we take several steps to ensure patient data privacy and security when handling patient information. Any RareX staffer who has access to any of the data entered, including those who verify data completeness and quality, must have training and certification in the federal rules that protect the privacy of people who participate in health research. People who contribute data to RareX can choose who they want to share their data with, including patient organizations, researchers, and biopharmaceutical companies. We're able to respect these patient choices through our partnership with the Broad Institute of MIT and Harvard, which supports RareX's data storage and sharing infrastructure. Access to RareX's data is enabled by a cutting-edge data access management service that governs use of data. This enables us to better protect patient privacy while granting access to data in a timely and effective manner. When a researcher is granted access to RareX housed data with the consent of the patient, that researcher must agree not to take any steps to try to re-identify patients and can only use the data for the specific purpose for which access was granted. In addition to privacy, data security is important to RareX. We recognize the growing number of data breaches among providers and payers have patients concerned about the security of their health data. RareX uses data encryption that meets or exceeds the highest federal data security standards. We're often asked whether RareX complies with the privacy and security rules under HIPAA, the Health Insurance Portability and Accountability Act, which created national standards that protect patient health information. Although many people think that HIPAA protects all healthcare information, it doesn't. HIPAA only covers health information that is held by a core group of organizations in the traditional healthcare environment, like hospitals, doctors, and health insurers. HIPAA doesn't regulate how a patient can share their own health information. Since data in RareX comes directly from patients, patient families, or with the patient's permission from a doctor, HIPAA doesn't apply to RareX, but we believe that RareX has put into place privacy protections that in many ways exceed those provided by HIPAA. For example, RareX only shares data for research with a patient's consent. RareX is spending a lot of time, money, and effort to get this right, so patient organizations don't have to worry about it. Instead, they can focus their precious resources on what matters most: finding the treatments and cures their communities need. To learn more about RareX and how you can work with us, go to rarex.org.